Warm greetings, everybody. My name is Lekan Kolawole, I'm a medical doctor. I live in Nigeria. First, I want to thank everybody who has given very encouraging feedback from the last health talks, and particularly for today's talk, which is about medicines, medication. I want to thank my brother and friend, Mr. Jacob Emoan, who advised that I don't use the word drugs because of the international community that have a negative attitude to the word drugs, that medicine is preferable when it comes to pharmaceutical agents. Thank you very much, sir. Today I want to talk about medications so that we can learn how to use these things responsibly and and get the best, so we can understand how to use medicines, how they work, and have a good idea why sometimes doctors and pharmacists give us the instructions to give us when we get medications. So, medicines are things that we use to treat illnesses. They are, things that we take into our bodies, whether through our mouths or by injection or any other routes, to treat illnesses. And I will just, for the purpose of this conversation, I will categorize illness into two broad groups: the ones that take place within our bodies, because something is wrong in our body, and things that invade from outside. For things that invade from outside, examples would be things like malaria, which is as a result of a parasite that comes in from outside through mosquito bites. Things like HIV, which is a virus that comes into our body from outside. For things that happen inside us, we can talk about things like psychiatric illnesses that afflict us, or hypertension, or diseases where our bodies attack its own self, which are called autoimmune diseases. That is, because normally when germs get into our body from outside, our body fights those things. But sometimes people's bodies turn against them. They produce chemicals that destroy various parts of the body and of that same individual's body, and we call them autoimmune diseases. So that's something that happens within an individual's body. So just for the sake of this conversation, I'm grouping illnesses in those two categories. And so for the two categories of illnesses, there are medications that we use in healthcare to address these problems. So how are medicines made? That's what the pharmaceutical industry does for us. They formulate these products, and then after it's tested, after these things have been proven to be safe for use and to be effective for the particular illness that they are created for, they are released for public use. And so why do we trust medicine? Why do we trust them? Maybe, okay, let me talk about why do we trust them? Before any medicine is released for public use, there are about 4 phases of trials for developing the medicine. There's a phase where the medicine is developed theoretically. That is, okay, what's the theory for curing this particular thing? And as a matter of theory, based on medical knowledge and science, knowledge of science, the medicine is like just on paper, okay, this should be able to achieve this, and of course then there's the experimental that to see if that can be achieved, if it will be effective for what it's been made for. And then when the medicine has been created, then it will be tested on animals first to see how animals respond to the medicines. After it's been tested on animals, it will be tested on a few individuals, a few people who are sick with the illness that the medicine is made for. And then, depending on how they respond, then the medicine can be used for larger population of people to see how they respond to. And what we only want to know about medicines, we want to know, are they effective for the illness? 1. Number 2, are they safe for the individuals to use them without causing problems that outbalance the benefits that we get from the medicine? So there must be a greater measure of benefits, by comparison to the danger of using the particular medication. So then, after the medicine has been tested on a large population of people, and we are satisfied that it's effective enough for the particular illness, and that the side effects, the unwanted effects of the drug on the individual, that is safe, adequately safe for human beings, that's when it's released for public use. And even after the medicine has been released for public use, there's still continuing, ongoing surveillance, where if any doctor anywhere in the world notices that there's a problem with this drug that is maybe not previously reported, or is not in the pharmaceutical literature that accompanies this medication, we can still report that we noticed this for some of our patients. And if those things are serious enough, medicines that were in the market before can be withdrawn from the market. And some of our older people will know that there were medicines that they used when they were younger that are no longer available today, because either they are not better drugs already available, better medications are already available, or some of them have been found to be too unsafe, and to be kept in the market for people. So that's how medicine. So that's why. So sometimes when we doctors are not very comfortable with agents that are with things people take for illnesses that have not gone through this rigorous process, it's because of this. Because we know what it takes to bring a drug to market, and that there's continuous surveillance. We have the measure of trust in that process. So that's why sometimes when we are asked, can I take this herb? Can I take this bowl? Can I take this? It's with caution that we let our patient take this thing. Or sometimes we tell patients we can't trust this thing. We can't tell you how it really works. So that's the rigorous process that drugs go through before they come to the market for mass use. So that's one. How do medicines work? How do they do that? How do they work? Medicines are chemical agents, and how do chemicals work? Chemicals do their work because of how they look. For example, if I want to construct a table, a piece of furniture, I will need to hit nails through wood. So I need a hammer, because a hammer is designed to achieve that. A hammer has a heavy part that is made of metal. It has a handle that can fit a human hand easily, and that can be used to strike the nail into the wood. So it's designed for that purpose. So chemicals, by their chemical design, they can achieve various things. So medicines too, by the way they are formulated, their chemical structure, the way they appear physically, that is their chemical structure, that's how they achieve what they achieve for us. And that's why they're also specific. And that's another reason why we don't trust when people peddle drugs around and say this drug can solve all problems. That doesn't make sense scientifically, because problems are different from one another. So that's why when the doctor hears that someone is marketing a medicine that claims to cure all kinds of illnesses, our first response is to be suspicious. That okay, because the mechanisms for various illnesses are different from one illness to another. In fact, even headache is headache, but there are different kinds of headaches, that come about by different pathways of illness. So medicines are very specific in the way they work, and that's how we also choose medicines. That's why also sometimes when you call a doctor on phone and just say, doctor, I have a belly pain, what can I use? The typical, a doctor who is not likely to give you something to use just by you telling him that I have belly pain, what can I use? Probably ask you some more questions so he can know the nature of your belly ache and therefore give you, the appropriate medicine. In fact, many doctors will even ask that they need to see you, to examine you, and some will not even stop at the examination. They will say we need to do some tests for you, or scan or whatever, so that the appropriate medicine can be given for that belly pain. For example, there are some kinds of belly pain that will respond to certain kinds of medication, and some other kind of belly pain will be worsened by the same medication that solved belly pains for some other people. So that's why it's also dangerous for someone to say, oh, I have this illness, and then someone tells them that, oh, I also felt this way yesterday, this is what I was given, take. It doesn't work that way. Each person must be reviewed, and what is appropriate for them, identified and administered. So how do medicines work? Medicines, as I said, have their own structure, and the human body too, has been created to have specific structure. Houses are built from concrete and blocks. Blocks are made from sand and water mixed together. So that is what I'm trying to say, is that there's a unit for creating, building a house. That is, we can say maybe unit of building a house is a block. The human body too has its own units from which it is built, which are, we call them cells. I mean, people that have done science in school will know what cells are. Cells are the building blocks for the human body, and there are different kinds of cells in our bodies, different kinds of cells, with different functions and structures, and different ways they look and different ways they act. And each cell too has, cells have, human beings, we have hair. So cells too have their own kind of hair. They have things that come out of their body the same way we have hair and nails. Cells too have their own kind of hairs and nails. We call them receptors. And so medicines are crafted, they are designed to, go to the cells that need their function, so that they can lock up with those receptors from the cells, and they make, the cells act the way they need to act. And then, so that's why each medicine has its own specific function in the body. And that's why if you use the wrong medicine for the wrong disease, it won't work. And that also explains another thing. There's some things there's something called side effects when we give people medication, or unwanted effects. What are unwanted effects? If someone takes a drug for a particular illness, for example, we all remember the days of chloroquine. People will take chloroquine, and then they will have itchy skin after some time. So that's, or people take diclofenac or aspirin for pain, or ibuprofen for pain, and because they took it for a long time, they developed stomach ulcers. So those are side effects of the medication, because the medication, it has its own function, but because other parts of the body will also respond to the medicine, those parts too will respond. But because those are not the things we tend to treat, those are called unwanted effects. So for example, let me illustrate it with normal everyday life. If, for example, someone lives in a one-bedroom apartment and is in the middle of the night, they cannot go out to cook, and they put a pot of water on the fire. The fire is intended to heat the pot and make it, or water to make it hot. But that's the desired effect. But because it is fire and it produces heat, that room will get warmer than desired. The room will become hot. So the fire is doing its job of heating the pot of water, but to do the additional effect of making the room hotter than expected. So that's what we call an unwanted effect, or a side effect. That's how medicines are. They'll do their job, but because the parts of the body that will respond to them are more than one, those other parts too will respond to that drug and give the effects that are not, that are not desired, or that are not intended. So those are side effects. But there's something else called allergic reaction. Allergic reaction is when someone reacts, when the body reacts violently, to certain things like medication. So those are different from side effects. Side effects are things that people can still manage till they finish their medication. For example, some malaria drugs that we use these days, some of them can make people feel like vomiting or cause abdominal pain. Those are side effects. People can manage it. But some people, when they take some certain drugs, their tongues can get swollen. They can develop very bad, blisters, swellings on their skin. That can be life-threatening. They can have problems that can be life-threatening. Those are, we call them allergic reactions. Those are things. So those kind of people should avoid those drugs. So for example, if you have taken a drug before and you reacted in a life-threatening way, if that drug too, is advisable that your children don't take the drug, because there's a chance that your children would have inherited, that tendency to respond that way to those drugs from you. And so that those are two different things. Reacting to a drug, which is an allergic reaction, and then having a side effect. They are two different things. Side effects can be managed if you can cope with the side effect. But allergic reactions to drugs, which can be life-threatening. And so that's why if someone has noticed that I react violently to this particular drug, in a life-threatening way, the person should avoid it, and advisedly to their children should avoid those kinds of drugs. So that's about what side effects are. And then the use of medicines is very specific, such that we know how long the drug lasts for in the blood. before the kidneys wash it out of the body, or before it's taken, the drug leaves the body naturally, because everything we take in leaves our body eventually. So that's what guides the dosing. So we want to give you medicine at a particular dose that will be adequate to treat the problem that the person has, the illness that the patient has, and yet and then we want to give the next dose of the medicine. We want to maintain a certain amount of that medicine in the body, because, for example, if we need to fight an infection for 4 days in a person, the level of the medicine in the blood must remain at an appropriate level, so that there's a consistent fight against the germs that are causing the infection, for example. So it's like one wants to so the bacteria, or let's say, okay, bacteria have entered the body, maybe through the nose. We've inhaled some germs into the nose. Person has a chest infection, I want to treat that. We need a minimum number of days to treat it effectively, and then during those number of days, the amount of the drugs, the antibiotics that we use to fight that infection, must be maintained at a particular level. So if the doctor says take this medicine 3 times a day, there's a reason for that. It's because if you take it in the morning and the second dose will be in the afternoon, if you wait till night before you take the next dose, the level of the medicine in the blood would have dropped too low. So you would have had a few hours when the fight against that infection was not optimal, when it was not adequate, and so we're not treating that thing effectively. And then if you're told to take it for 5 days, there's a reason for that too. And this is, so there's a reason for that too, because we expect that to kill that germ, totally, we need to continue the battle for 5 straight days, and then after that we can be confident that, okay, it's very likely that we have overcome this bacterium or this germ or this thing that is causing this invader, that is causing the illness. And that's why we also, and so when you may start feeling better from day 2 or day 3 or day 4, if you are going to take this for 7 days, you are feeling better already, but the battle is not yet over. So it's better to continue for the whole period for which the medicine was prescribed, so that you can get the benefits of that particular medicine. And that's what guides doctors, in prescribing medicines, as far as how much to take, and for how frequently to take it, and for how long to take it. And then also, age can be important for children too, because for children, their system is not as mature as adults, as the adults own, and therefore we measure their own drug dosage medicine amount that they will take to based on their age, or rather by their weight, even preferably by their weight, because that guides us that, okay, we're not giving the person too much. So too much, and then if someone takes too much, more than the dose, it may be harmful. So medicines, just a little too much can be very harmful, and if it's not adequate, it may not do what it needs to do. And then I will also, speaking of side effects too, we must realize that medicines come in families, and generally speaking, the medicines that belong to the same family act in the same way. For example, for ulcer, and usually their names sound similar. For ulcer, for example, there's omeprazole, there's rabeprazole, there's esomeprazole. Those are 3 different drugs, 3 different medication, and they are all used for ulcer, to reduce acid production in the stomach, so that the ulcers, the wounds in the stomach, can have a chance to heal. That's what we use those things for. And then for example, hypertension too. So if someone has a side effect that is not bearable, we must I've spoken about family of medicines so that we can know that there are alternatives, because usually they do the same thing. So for example, if someone has a very bad responds badly to a particular choice of medicine, there are other families that will achieve the same thing and will be safer for the person. For example, for hypertension, because hypertension is usually a disease that needs to be catered, taken care of for a lifetime. Usually, most people will need to take their medicines for life, except there's a miracle that takes away that normalizes the BP permanently, or whatever, or there's a reversal of the problem that caused the person's particular high blood pressure. If usually people that have high blood pressure, like people that have diabetes or psychiatric illnesses or seizure disorders like epilepsy and such things, usually those things have to be taken for life. So imagine a man that is taking medicines for high blood pressure, one of the common side effects that some men have with some drugs for high blood pressure is sexual dysfunction. They have problems with achieving erection. So, there's no need for that kind of person to stop taking their medication altogether. All they need to do is tell their doctor that, I don't know, since I started taking these drugs, they should know that their erection has been faulty. And what just needs to be done is for that, the doctor will usually know which of the drugs causes that problem. And then that can be taken away, and a drug that will not cause that same problem given to the person. In fact, even when we're treating men for hypertension, we usually consider that in choosing medicines for them. We will even try to avoid a medicine that are known to cause that kind of problem. And so there are different. That's just an example. There are different examples of unwanted. For example, there's some other drug medicines that can give people dry cough. You can just withdraw the cough, the medicine, and give a safer alternative. So that means that we don't have to run away from any medicine because of side effects. When it comes to treating infections, that is, what's an infection? A living thing that usually our eyes cannot see has come into our body from outside and is giving us problems. And as I said before, an example is malaria, which is caused by some parasites injected into our body by mosquitoes when they bite us. Another example is bacteria that can cause various kinds of infections, and of course, I said viruses before, and there are other categories too of things that can enter our bodies from outside. They're living things, give us problems when they come in. So there are medicines that we use for these things, and the medicines too are specific. When we're treating these things, what we're trying to achieve is either to kill them or to strengthen, the body. So those are the various ways that we use medicines when we're treating infections. And when it comes to infections, we are always the specific choice of medication for specific infections. And in fact, two different people can have the same kind of infection. The medicine that works for this one may not work for this one. So that's why it's good to really work closely with our healthcare providers, our doctors, when it comes to treating these things. It's not advisable to just get medicines because they work for our friends or family members. Another thing is that another thing I would like to use the opportunity to say is, sometimes you go to a pharmacy to ask for a medication that the doctor wrote for you, and the pharmacist tells you that it's not available. And but the pharmacists, they are trained to let you know the alternative that you can choose. So even though the doctor didn't write that, so you must trust your pharmacist when she tells you that, or he tells you that, well, your doctor wrote this, but it's not available. This is available and is a reliable and is a good alternative, is a viable alternative. You must trust them. You don't have to insist on the particular one that your doctor wrote for you. That's what pharmacists are trained to do. In fact, even sometimes we consult pharmacists for advice, even doctors, sometimes in choosing medication. So those are a few things that we need to know. I may have missed out on some of my points here. Just a minute. Okay, then another thing is that when we abuse medication, there's a risk to not only yourself, to the whole community and the whole nation. When we don't treat infections adequately, the infections can come back with more power. We call it resistance, and then in the future, that medicine will stop working for those infections, and then it will be necessary to be getting very expensive alternatives, or even, some infections can be untreatable in the future. That's why it's good for not only yourself, but also for the whole community and the country, in fact, for the whole world, that we are responsible in the use of antibiotics particularly. So, all right then, I think I've exhausted my points, and I hope if I have any other ideas that I may have skipped in this conversation, I'll probably follow up or add some notes. Thank you for listening, and I hope it's been a pleasure listening. Thank you very much.